Head into the holiday season, the new variant top of mind for many families. Joining us live now, help answer some questions sorted out, Dr. George Rutherford, professor of epidemiology and biostatistics at UCSF. Doctor, multiple cases Omicron now confirmed in the U.S. One of the latest, a domestic traveler, of course, different from our local case who self-reported after going to South Africa. So that difference in travel, one who never left the U.S., what is that telling you?
Well, it tells you there's local transmission. That individual who's from Minnesota actually attended a big convention in New York in the Javits Center during the period of time that he most likely became infected. So, you know, if there are people from overseas or from South Africa where this convention was an anime convention, it's not at all surprising that something could have happened there.
And Doctor, a lot of questions about how well our vaccines will work against the Omicron variant. Sure. When would you expect to know that answer to that very big question?
Week or two.
Okay.
I mean, they're doing the test now, obviously. Yeah.
And so far, the cases have been mild so far. Do you think that's because this particular variant is weaker, doesn't cause severe disease, or do you think that it's because the vaccines are really working?
Yeah, that's a really good question. I think it's potentially that we may be seeing, I mean, this is the land of wishful thinking. We may be seeing mutations to a better adapted virus that makes its host less sick than the earlier versions, especially Delta. Now, again, that may just be wishful thinking or whistling back past the graveyard or whatever analogy you want to use. But the news from South Africa is that this is a relatively mild disease in adults. There's some questions about children that are very much up in the air, but it's in adults, in very, 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 very small numbers of adults whose clinical courses have been reported. It seems not to be as bad as the prior versions.
Could you elaborate real quick on the children? Is it cause more disease, less disease? Just want to clarify that.
There's a question. There's been an outbreak of pediatric respiratory illness in Johannesburg and Pretoria. And the thought is that could this be the Omicron variant? Could this be Delta? Could this be influenza? Could this be respiratory syncytial virus? There are lots of different pieces to this, but it's something that's been flagged that needs to be followed up and run to ground.
Now, both Merck and Pfizer are seeking approval from the FDA, their antiviral meds. Is what you're saying about this variant, does that lead you to believe you think those pills will also be effective against Omicron?
Yeah, I think there's a really good chance. I mean, we can test that pretty easily. It depends on what their exact mechanism of action is and how they disrupt reproduction. But I think that I think early tests would suggest that they're equally effective. I mean, the early suppositions are that they're equally effective, and we just have to see how it plays out.
California's positivity rate going up, and with people gathering for the holidays, do you think that we're going to see another winter surge, even with the high vaccination rate?
Yeah, you know, there's California and there's California. We sit here in the Bay Area with very high vaccination rates and people wearing masks and doing basically everything, you know, that we ask people to do. Large swaths of the state don't do that and have very low vaccination rates. So the question is how does it blend together? In Southern California, where a lot of the immunity was caused by naturally acquired infection, there's some very preliminary data from South Africa that suggests that the reinfection rate with the Omicron variant is higher than with prior variants. So it means that even if you had, say, the beta or the alpha variant in last spring, you may or may not be very well protected against the Omicron. So that's, again, something that's being pieced together and we'll have to figure out. But that has real implications for, you know, pushing vaccination, pushing mask mandates and things like that.
Still so much unknown right now, unfortunately.
No, so far, I mean, it's not horrible, right? Yeah, that's right. The good news.
That is good. Dr. Rutherford, thank you so much for joining us, as always.
You bet. A real pleasure.